She's an advocate for Maryland nurses and continues to use her expertise to improve the health care for county and state residents. CTV News sat down with Dr. Rachel Sherman of Hospice of the Chesapeake and talked about the work that drives her every day.
Do what I do for accolades. I just want to see my community better.
Meet Dr. Rachel Sherman. Through her work, she's looking to improve hospice and palliative care for patients across the state, but particularly here in her home county of Prince George's. She recently clocked more than 4,000 hours of volunteer work, which landed her the 2024 Presidential Lifetime Achievement Award at the Juneteenth celebration of Black Networking Awards event.
If no one steps up, then our community will fail. And that's part of the reason why I dedicate so much of my time outside of work and even within my work, just making sure that I address everything in my community that I possibly can. So when you stop counting the hours and you look at the good that you're doing, it makes it so much easier.
Sherman wears many hats and likes it that way. She not only is an Army veteran, but she is also a nurse practitioner and is on staff at the University of Maryland Capital Region Medical Center in Largo. But her passion is what she is doing with Hospice of the Chesapeake as the Director of Advocacy and Legislative Affairs.
So I'm not just prescribing medications and giving orders. It's actually sitting at dining room tables, talking with family members. If I'm in the grocery store and someone comes with a need because they know I work for hospice, I take the time to talk to them, to empower the community. So that's part of what I do.
Sherman says two of the biggest challenges that Maryland nurses are facing is the high cost of a nurse education and safety in the workplace.
Nurses are subjected to violence all the time. And it's not that people turn a blind eye, but they're so busy. People don't recognize the danger, the hazard that comes with being a nurse. Even in hospice, we're going into people's homes. You never know what you're going to encounter. Is it going to be a dog? Is it going to be an unsanitary environment? Is there going to be some type of family dynamic that we have to be prepared to deal with? And we can't just walk away. Nurses are not trained to do that. We can't walk away. And then we take all of that home. So you have to think about the mental impact on nurses as well, especially coming through COVID. My profession has been through so much, and we continue to go through so much, but yet we continue to show up.
Sherman is also on the Maryland Board of Nursing and was appointed to the board by Governor Westmore back in 2023. For more details on the services of the Hospice of the Chesapeake, visit the website on your screen.